Well, it was, there was a lot of, I'd say, stress at the linen service, and affected a whole range of areas. It wasn't just that they were stressed, there was sick leave because of it. There was tension between different staff members because of it. So there was a situation that had to be fixed. They brought in a facilitator to do this program. We set it up. We picked people from each area in the linen service, and they were to represent their area. And everything we did, we took back to the staff, and they give us all the information we needed, like where they found the most stressful part of the job, what caused them the most problems. Well, we had representative from the office staff, we had one from management, we had one from each section in the Loddon Linen Service, and then we had our facilitator and someone from OH&S, so we covered the whole range. We met every fortnight. They went for anywhere from 2 to 3 hours. We had our facilitator, and we had our own lists, each group, each person from each section of the linen service, with the problems that part of the linen service had. And with that and the facilitator, we worked out about 8 sections to cover the whole range of issues. So it took us a while to sort out what we wanted to do first. As we went through each category at our group, we actually went back to the manager and we sat down with him and told him what we'd worked out and what we thought needed to be done, and he worked with us too, and so we could implement those issues. And so as soon as we'd come up with a problem and a solution, we implemented it. I think it's better because everyone was involved. It just wasn't that group of people that were asked to, sit in on the meetings. Every person in the linen service, from management to the drivers to the workers, were all involved. Over the years, we've tried to tackle this issue, but we never actually involved the staff. It was always done through the supervisors and the managers, and we never actually asked the staff what the main problems were, so we were looking at it differently to what they were. Well, one of the most simplest things we found out, I don't know if you've ever been through the laundry, but they work in groups on each machine, and we knew that the person in the number 1 position was the team leader for that group. So you went to them and told them what you wanted done. But the managers didn't actually know that that's how he knew that we went to the machine and told these girls, this is what I want done, but he didn't actually know that we had a number 1 person. So all it took was we put a number 1 in that position, and anyone that wanted to discuss anything that was going on in that machine, they went to that person because that person, every time the manager would go and speak to someone else, they got upset because they thought he was overlooking them, where it was their position to change all these things. We found a lot of it was down to communication and the way people perceive what you say. You've got to be careful on how you say it. We were very surprised. We were put up for the WorkSafe Award, and we had a few meetings, and that's where the video came in. We had to do a video to send down to the WorkSafe committee, and we got to be a finalist, so we were invited down to Melbourne, big do down there, and it was very surprising. We actually won. It was really good, and we brought home a trophy and a lot of pictures we put up around and took it throughout the healthcare group and showed everyone, because it's a rare thing to win one of these awards. Up until then, a WorkSafe award, it was for something tangible. You could see it, you could feel it. But here was a program that was all, it was stress and prevention of all these problems. It was something you couldn't see except in the figures. So it was different to win something for that. We find now that if there is an injury, most of them don't even have time off. They just say, look, I'll work through it, you know. So we work with our staff if they have got a problem but they don't want to have time off. We will make sure they do duties that will not stress that part of their body. So they're more inclined to stay at work than go off on work cover. It wasn't the major problems, it wasn't the machines, it was the communication, the tiny little things, that the way you present something made all the difference. And it does come down to all morale. And what better way to build morale than communication?